Right now, the following segment is sponsored by Aurora BayCare Medical Center, and joining us is Connie Feldman. Hi, Connie.
Good morning, Rachel. This morning we're talking with Dr. Micheal Schnaubelt from Aurora BayCare Medical Center, and we're talking about hip replacements. Dr. Schnaubelt, can you tell us what makes somebody a good candidate for a hip replacement?
Sure. At Aurora BayCare, we have a specialized team of orthopedic surgeons, and as part of that team, we utilize a special procedure called the anterior hip replacement, which means from the front. And as part of that approach, we basically look for people that have bad arthritis, whether it's post-traumatic from an old injury or just general everyday arthritis. And it's people that have failed conservative treatment, like injections, medications. Those are folks we look at for a hip replacement.
And what are the advantages of the anterior hip replacement we were talking about a little bit earlier?
Sure. So an anterior replacement is done from the front. The incision is about the width of my 4 fingers here, which is much smaller than a posterior. The traditional replacement goes from the back side here. And that goes right through the gluteal muscles, which are your main muscles for getting around and walking. So by avoiding those muscles, we don't cut any muscle from the front. We just divide it and move it to the side. That provides much less pain, much quicker recovery. We've done them the same day, where you go home the same day. I've even done both hips at the same time. So the recovery is much quicker. The return to sports, return to work, return to normal activities is much quicker. The other nice thing is they're less prone to dislocate or pop out because we're not cutting the muscle, and the muscle is what helps keep the joint where it should be.
What an advantage.
So, and we don't have the restrictions either. Traditionally, we'd put restrictions where you can't flex your hip up or rotate it, cross your legs. With an anterior approach, we don't have to put any of those restrictions on patients typically.
Okay. If someone is a candidate for an anterior hip replacement, what kind of things can they do to prepare?
Sure. So we like to get people medically tuned up as best we can. If we're a smoker, we'd have you quit smoking. Some folks will have to lose weight, and then we'll get them in better shape in terms of doing some physical therapy in a prehab program.
All right, Dr. Schnaubelt, thank you so much for being with us this morning.
Thank you.
And if you want to find out more information about Aurora BayCare's specialized orthopedic team, please visit aurorabaycare.com/ortho.